Support Don't Punish is a global campaign to end the war on drugs. Our message was simple. Drug use is a health issue, not a criminal one. Around the world, the response was overwhelming. More than 2,000 people sent in photos on Facebook and Twitter.
Uganda Harm Reduction Network UHRN is a youth-led drug user initiative established in 2008 to respond to the drug use crisis in Uganda. The network works to advocate for practical interventions aimed at supporting and addressing issues of drug users. Since inception, UHRN has been advocating for a national platform for health and policy programs that promote good practices and supportive environment for the implementation and expansion of harm reduction programs for people who use and inject drugs in Uganda.
I've been a drug user for over 20 years. Basically starting with soft drugs till I had to use hard drugs.
We are isolated in all forms, all dimensions of society: health, the law, education, all those services. We are neglected, but
junkies in a ghetto in Mbarara town, Mbale, Busia and Gulu sniffing and smoking ganja. Why should this habit be regarded more as an illness that requires medical attention and psychosocial support rather than as a crime? This is what the global campaign known as Support Don't Punish is trying to instill in the public, policymakers, decision makers and law enforcers. And in Uganda, the Uganda Harm Reduction Network UHRN together with Community Health Alliance Uganda CHAO are implementing the HIV and harm reduction project, aiming at increasing access to essential HIV and harm reduction services for people who inject drugs in East Africa.
There's a need of helping drug users, more especially injecting drug users, to reduce the high prevalence rate of HIV among injecting drug users. And it has been found out that the prevalence rate of injecting users, countrywide research that has been done in different countries, and particularly in Uganda, it's at around 17%, which is more higher than the general population. So that's the genesis of this project, to make sure that stakeholders and other development partners intervene to make sure the prevalence rate is reduced in these groups of people, the injecting drug users.
This program believes criminalizing drug use has caused more damage and not reduced drug use.
It's important that we look at our laws in mind with the population that we serve in public health. People who inject but also use drugs are part of the key populations in Uganda. Unfortunately, the laws in Uganda criminalize users, and this doesn't help the epidemic.
The Uganda Harm Reduction Network also believes that policymakers and health service providers need to understand who uses drugs, why they use drugs, and the implications of this on their health.
The intensified HIV response, we are targeting these populations. But of course, there are quite a number of things that we need to do. Some of them are within the policy, addressing policy issues, addressing guidelines, and of course delivering services to these populations in terms of building capacity for the service providers so that they understand these populations and they are able to offer services that these populations need.
The package being developed by the Ministry of Health includes information on prevention of HIV, the use of drugs, psychosocial support, providing for their needs, looking at drug users as sick people. In short, the new government response seeks to address the problem rather than punish the users. It's in this light that the Ministry of Health plans to develop tools that can help in gathering more information about people who use drugs and abuse substances and how they can be integrated into the provision of health services of the country.
We note that
One, we don't have a policy environment that embraces harm reduction practices within the country. And for that, whatever we do is basically on a pilot basis, but not more of like a government position or a Minister of Health position to make sure that harm reduction interventions are rolled out or upheld within the country.
The Support Don't Punish campaign recognizes that populations that use drugs need societies and governments' support like everyone else because their well-being or lack of it can have a huge impact on the health and economic well-being of the country. While it is not yet official policy to support rather than punish people involved in substance abuse, the Ministry of Health has recognized this population is a crucial target in primary health care and efforts to prevent the spread of HIV/AIDS.
We are going to be gathering information to inform policy. We are also going to be coming up with the indicators that will help us monitor the response in this population. Not just people who use drugs or injected drugs, but the entire group of people that we categorize as key populations.
Basically, I would love to urge or to call other civil societies to support the issues of drug users, to come up and support this call. This is not our call. This is a community call or a country call, because a drug user may be a drug user, but a person whom a drug user sleeps with may not be a drug user. So, in order to fight against HIV, in order to reach at 90-90, we all need to join hands in this fight.
But why should drug use and substance abuse be an issue for national concern? These are vulnerable populations who need support, and the numbers are also growing. Already, several organizations are piloting these strategies. The Uganda Harm Reduction Network (UHRN) is one that is deeply involved in the rehabilitation of drug users using the harm reduction strategy. It has centers in Mbale, Busia and Mbarara where it's being piloted hand in hand with the Support and Don't Punish campaign. The harm reduction program is a 3-year project backed by the Global Fund.
We need to make the communities in different categories and appreciate and understand what it is. Secondly, after appreciating, we need to ensure that the services that require, that are specific to the people who use drugs, are available. Because you may go to have the person using drugs, and he goes in a facility, and then the health provider says, no, for you use drugs, how are we going to deal with you? So we need first of all appreciate and understand these people, but also second, we also need to know where they are.
Most are found in the ghettos and slums of major towns across Uganda. These are deprived areas with inadequate or non-existent health facilities. Junkman is a long-standing drug user in Kampala. He has smoked and graduated to injectable drugs. He says drug use is widespread in the ghettos.
I use all. It depends on the situation I'm in. Yeah, I can't categorize because for the beers it's normal.
Nkozesa lyo amanyiddwa nga brown sugar.
In the deprived slums, the spread of HIV is real and a threat due to needle sharing. Junkman says cocaine users are aware of the harm but are forced to share needles due to the high cost for a dose.
Twesondayo ne bannaffe ng'abantu 10 oba 12 tugenda ne tugula brown sugar oyo kuba asiwa ssente ntono nga nze kinoomu sisobola mwetuusaako.
Gift Walugembe holds a similar sentiment. He lives and heads a gang of drug users in Mbarara town. Needle sharing is routine. Neither are there HIV prevention measures nor sensitization campaigns for healthy living habits.
Tusanga ebisinga nga embeera eyo tukozesa empiseemu abantu 8 naffe fenyini kiraba nti kubanga tukituviiriddeko okulwala.
We inject ourselves, but we inject one at a time. We call it a shot. You take a shot, another one takes a shot. Yeah, we can share like 7 to 8 guys. Yeah, a single dose.
Junkman and Gift agree that in the interim, a needle exchange program is crucial as a primary measure to prevent HIV.
Bisezo omuntu ali muganda mulwanyisa kawuka ka siriimu kyokka ate ffe nga mwatuleka ebbali kiba kitegeeza enekuba empisolo ngala n'agyekuba tuba tusaasaanya akawuka naye ate ffe mutuleka ebbali singa mutufunira mu biseezo netulema okuzisheyalinga omukyalikoze amakulu
ekikwatako yenna bw'abeera asobola naddala kati nga kino ekitongole ekyaffe kituyambye nnyo okutusomesa okumanya bakwatagane.
However, currently the only response to drug users are arrests by police, but according to Gift, this cannot solve the problem of drug use in Uganda.
Kubanga era tunoonyeza ddala egye tubeera ate oluusi olw'okuba nti society yeekulaba bwetu ne balowooza nti biki kyeyina okukola kunoonya so oluusi ate toli mumenyi w'amateeka.
Drug use has so many consequences that all end up harming users' health. For instance, needle sharing causes HIV infections to drug users. Drug use can lead to unprotected sex and therefore HIV and STD infections.
Sometimes understanding bukomawo biri ebidagala biweddeko nga si kyetegeera oluusi bye baba baŋŋambye n'embyegaana n'obyegaana.
Sex addiction and drug addiction have the same pathway. And for the people who engage in sex for recreation and socio-economic purposes, they will use drugs because, like things like sex work are not acceptable and stigmatized in society.
This is why UHRN and other like-minded organizations are championing the support rather than punish campaign. Globally, criminalizing drug use has driven underground costing enforcers billions of shillings in a futile cause. Uganda Harm Reduction Network is deeply involved in advocating for the rights and health of people who inject drugs in Uganda and advocating for the implementation and inclusion of 9 harm reduction interventions in Uganda, which are life-saving interventions.
Uganda Harm Reduction Network, that's when we call upon the relevant authorities to embrace harm reduction interventions in the country, whereby we need like needle and syringe exchange program that will help to ease this issue of syringes. And more so, these injecting drug users, they don't use specified syringes for injecting. They just go to the pharmacy or clinics and get whatever needle they wish to use and which is not recommended for them to use.
It's time to leave behind harmful politics, ideology and prejudice.
Under the harm reduction pilot in Busia, Mbale, Mbara and Kampala, QHRN recognizes the importance of locating drug users and reaching out to them if any interventions are available to help win them and cure them of the problem.
They normally, whenever we advocate for their health rights, we advocate for their rights, the first question which comes along is where are they? How many are they? And of course, as Uganda, we've had challenges of data. But I'd like to inform you that within this project, we are going to have studies, research studies, the rapid situation analysis and size estimation within the country. So this one will give us a good picture of the data that we can be able to use and to help other stakeholders in the programming of injecting drug users within the country.
Most importantly, specific policies and messages that integrate the needs of drug users should be crafted to address the problem.
We need to look at our prevention messages, ensure that those prevention messages integrate the needs of people who use drugs. We need to ensure that people who use drugs are located and are accessed with preventive services.
The pilots in Busia, Mbale, Mbara and Kampala have indeed demonstrated that if reached out to and given assistance rather than punished, support rather than punish can lead to more positive outcomes.
This campaign tries to bring out the message that our brothers and sisters need help. They don't need to be punished. If you're a police officer and you round up these drug users, it's not the best way to do it. In these countries that have embraced harm reduction interventions, whenever they get drug users, the best place to take them is a rehabilitation home. They don't take them to prisons because it has been found out that drugs are also in prisons.